If you have diabetes or even pre-diabetes, and you've ever felt pins and needles in your feet, stop scrolling now. In the next few minutes, I'm going to show you a natural, science-backed routine to dramatically relieve and also lower your risk of diabetic neuropathy, naturally, without medications. Most people never hear this simple approach, yet it can make all the difference in protecting your nerves. If you want your feet, your balance, and your independence to be there for the long haul, this video is for you. Hi, I'm Dr. Ole Olson, America's Neuropathy Coach and founder of Asuta Health Neuropathy Centers. This is one of the only channels on YouTube entirely dedicated to helping people with peripheral neuropathy finally get lasting relief. Subscribe now if you're looking for natural relief, proven daily routines, and real-world solutions that actually work. You're in the right place. At Asuta Health, we help you move better, feel better, and live with less pain every single day. Because you matter. Here's the truth. Diabetic neuropathy, nerve damage from elevated blood sugar, is one of the most common and costly complications of diabetes. It often starts quietly. By the time you notice burning, numbness, or that weird sock bunched up feeling, nerve damage may already be underway. And once nerve damage is advanced, it's hard to reverse. But here's what most people miss. Neuropathy is not just about pain. It raises your risk of falls, foot ulcers, infections, and even amputations. What are the biggest causes of neuropathy? It's chronically high blood sugar, high blood pressure, elevated triglycerides, smoking, excess weight, and long-standing diabetes. Even certain medications like metformin can lower vitamin B12 levels, which can also impact nerve health if not monitored. I realize this sounds serious, but it's not hopeless. The goal today is prevention, building daily habits that protect nerves, reduce inflammation, and improve circulation. These are not quick fixes, just the steps that truly improve your nerve health naturally and align perfectly with your doctor's plan. If you're thinking, I've tried to walk more and I've tried to eat better, I can't get it. Managing diabetes can feel like a full-time job. Meals, medications, stress, sleep, costs. Navigating all this is confusing. Maybe you've heard contradicting things like don't eat fruit, keto, carbs are okay. If you've tried supplements because someone on the internet promised a cure, it's exhausting, I get it. You don't need more clues. You need a clear, doable routine that fits perfectly into your life. So let's make this practical. Think of this as a nerve protection system designed for diabetics that you can start today. We'll focus on controllable wins that stack up over time. Are you ready? Keep watching. We'll go deep on each step and each one builds on the next. So stay till the end to get the full benefit of this nerve protection system. Let's go ahead and get started. Here's a simple, natural 5-part plan to protect your nerves, specific to diabetic neuropathy. Step 1, lock in blood sugar stability. Aim for consistency, not perfection. The strongest protection against neuropathy is keeping that blood sugar in range over time. Work with your clinician on targets. Keeping your A1C, that 3-month blood sugar average, around or below 7 helps protect nerves from damage caused by high glucose. A1C is a lab test that shows your overall blood sugar control over time, given a bigger picture than just the daily finger pricks. Maintaining strong time in range, meaning your blood sugar stays within your target range, often between 70 and 180 milligrams per deciliter, often lowers your risk of developing or worsening diabetic neuropathy. The more time your blood sugar stays within this healthy range, the less stress and damage your nerves experience. Eat things in this order: non-starchy veggies and protein first, then carbs. This simple sequence can minimize glucose spikes. Fiber up your plate, at least 1 palm of protein, 2 fists of non-starchy veggies, and a cup of carbs works for most people. Walk 10 minutes after meals. This one habit reliably improves post-meal glucose levels in circulation. Start your day with a protein-packed breakfast to avoid a big early spike. Consider a tablespoon of vinegar and water before high-carb meals if your doctor says it's okay. For many people, it gently reduces that spike. Prioritize consistent meal timing, hydration, and stress management. Those are glucose levels most people overlook. Step 2, protect your circulation and metabolism. Blood pressure, cholesterol, and triglycerides matter for nerves. Naturally support them with a Mediterranean-style pattern. Consume fish 2-3 times a week. Include olive oil, nuts, seeds, beans, and plenty of colorful vegetables, as well as modest whole grains. Cut back on the smoking and vaping. Nicotine actually narrows blood vessels and directly harms your nerves. If you smoke, make quitting a priority for your project this year. Every day smoke-free improves blood flow to your feet. Alcohol, keep it moderate or eliminate it altogether. High intake of alcohol actually worsens neuropathy and glucose swings. Step 3, daily foot care ritual. This should only take 2 to 3 minutes a day, but you need to inspect your feet every day, the tops, the bottoms, and in between your toes. Look for redness, cuts, blisters, or calluses. If you find any of these, get them checked and treated by your doctor. Moisturize dry skin, but not too much between the toes, as moisture can invite infections. Trim your nails straight across. This avoids ingrown toenails and associated complications with that. Wear socks that fit well and shoes that have a nice wide toe box. Never go barefoot on hot pavement or cold floors if your sensation is reduced. If you see a sore that isn't improving within 24 to 48 hours, or you notice new numbness, call your clinician right away. Early care prevents big problems. Step 4, movement that nerves love and increased blood flow. Target for 150 minutes a week of moderate activity. This could be walking, cycling, even swimming. Plus include a couple of days of strength training. Consistency beats intensity. Let me say that again. You don't have to go crazy to get the benefits. Just do it consistently. Add foot-specific exercises that improve blood flow for 3 to 5 minutes a day. This can include heel raises, toe scrunches with a towel, and ankle circles. Also include balance exercises such as heel-toe walking and single leg stance. Better strength and balance mean fewer falls and better nerve signaling. In fact, I have videos on my channel that demonstrate blood flow and balance exercises specifically for neuropathy. You can find the links in the description below. If walking hurts, try chair exercises, pool workouts, or a recumbent bike. The best workout is the one that you'll actually do. Step 5, the nutrient check. Ask your clinician to check vitamin B12, especially if you're on metformin, vitamin D levels, as well as thyroid function. Correcting deficiencies supports nerve health. For your meals, build a nerve-friendly plate. Leafy greens, eggs or dairy if tolerated for B12, as well as fish for omega-3s, legumes and nuts for magnesium, berries for antioxidants, and spices like turmeric and cinnamon in your cooking. I'll also link our top neuropathy diet and meal plan videos in the description below, so be sure to check them out. About supplements. Some evidence suggests alpha-lipoic acid or acetyl L-carnitine can help with neuropathy symptoms in certain cases. These are not cure-alls, and they can interact with medications. So talk to your clinician before you start any supplement. I have videos that go into detail about alpha-lipoic acid, acetyl L-carnitine, as well as other supplements specific for peripheral neuropathy. You'll find the links in the description below. Now, here's your bonus tip. Sleep and stress strategies. Poor sleep and chronic stress spike glucose and inflammation. Aim for 7 to 9 hours, consistent bed and wake times, and a simple wind-down ritual. Try a 4-7-8 breathing pattern or 5 minutes of box breathing to lower cortisol and stabilize blood sugar. It's also important to know when to seek help right away. If you notice new numbness, burning, or tingling that wasn't there before, or if you have a sore, a blister, or a cut on your foot that isn't improving within 24 to 48 hours, contact your healthcare provider right away. You should also reach out if you see color changes in your feet or toes, new swelling, or if you experience pain when walking that eases with rest. Getting prompt care for these warning signs can prevent small issues from turning into serious complications. At Asuta Health, our focus is the treatment of peripheral neuropathy, including diabetic neuropathy. We use advanced, non-invasive therapies designed to improve circulation, support nerve regeneration, and reduce your pain naturally. Our mission is to help you move better, feel better, and live with less pain every single day, because you matter. We have 4 locations across the Midwest, and you can find all the details in the description below. Now here's your daily checklist to keep you on track. 1. Walk 10 minutes after your 2 biggest meals. 2. Protein and veggies first, carbs last. Number 3. 2 to 3 minutes of foot inspection daily. 4. Quick balance work and foot mobility exercises. 5. Half of your plate non-starchy veggies at least twice a week. 6. Lights out at a consistent time. And 7. 5 minutes of breathing to unwind. Now it's your turn in the comments. Tell me 2 things. First, what's the one habit you're committing to this week? Is it post-meal walks or foot checks? Secondly, what's your biggest roadblock to stable blood sugars right now? Drop a comment below and let me know. I read and reply to every comment. If this was helpful, please like this video so it reaches more people who need it. Share it with a friend managing diabetes, and subscribe for weekly, practical strategies you can put to work the same day. The next video you should watch is this one. Best dietary choices for diabetic peripheral neuropathy, where I dive deeper into healing foods for diabetic neuropathy, meal planning, shopping, and meal prep tips, and reveal one everyday spice that's been shown to help regulate blood sugar levels. Go ahead and watch that video next.